My dear friends, greetings from the Community Positive Health Attitude Initiative. My name is Professor Edin Dibuago. I am a professor of public health medicine and I'm the team lead for Community Positive Health Attitude Initiative. We give health talks. We do all we can to give information about your health to make you stay healthier and live longer and then prevent diseases. This one is the second episode of our video on hypertension. And in this episode, we are going to be talking about types, stages of hypertension, and then we'll tell you about the diagnosis. So, types of hypertension. Incidentally, hypertension is broadly said to be of two types, broadly. There are other smaller categorization I'll give you. And these are the primary hypertension and secondary hypertension. Primary hypertension, also, funny enough, we say it's essential hypertension. But I remember from medical school, we used to wonder what is essential about hypertension. That is a problem, yes. But that is a type, and we found out that 90% of hypertension cases you have is what we call primary hypertension. Primary in the sense that the cause, you can't put your finger on anything that is causing it. So the cause is unknown, So that's the one we call primary hypertension. So, and that is why it is so important that, you monitor yourselves and then find out if you're hypertensive. That is 90%. And then the 10% of cases are what we call secondary hypertension. Secondary in the sense that is hypertension arising from some other cause. Some other problem is causing it. And some of these problems that generally can cause hypertension can be problems from diseases of the kidney. It could be cardiovascular, diseases of the heart can give you hypertension. This hypertension could be as a result of neurogenic problems, things that has to do with your nerve. It can be as a result of endocrine diseases, diseases of some of the glands in your body, like thyroid gland. People who are thyrotoxic have elevated thyroxine level and all that. They could have hypertension. Of course, remember, in our other video, we told you that hypertension is usually associated with diabetes. If you find out that the hypertension is coming from any of those causes, they are called secondary hypertension. And then the good news is that if you treat the originating disease, the person is free of the hypertension. That's why it's important to investigate and find out whether it's primary or secondary hypertension, anybody that has hypertension. But again, there are other mild types, other fewer types of hypertension, such as pregnancy-induced hypertension. It's been found out in few women, pregnancy can give you hypertension. But please, for those that are medically inclined, remember, pregnancy-induced hypertension is different from a condition in pregnancy where the blood pressure is high. This other condition is known as preeclampsia. It is when you have the blood pressure raised, but there are other features like you have swollen legs, and then you have protein in the urine. You don't say that one is a pregnancy-induced hypertension. That's another obstetrics emergency that you must watch. Because if you don't handle that one fast, the woman could have a seizure, and then which could be life-threatening. Seizure is when it has an eclampsia. So it's different. There's the one they call white coat hypertension. White coat in the sense that apparently this person is normal. But once you bring stethoscope, or once, doctors, they used to use white coat. They dress well in white coat, finely dressed. So once they see the doctor in the clinic and you bring stethoscope to measure the BP shoots up, So that is something that if you notice it happens, you change venue, you get other people to measure, to establish. And that's why it's advised that you have to check the hypertension at least 2 times within a week before you conclude, There's this other rare type that we'll find in people commonly, mostly who are 60 years and above. It's called isolated systolic hypertension. You'll find out that the systolic blood pressure, which I said is the one recorded when the heart contracts while trying to, pass blood. When it contracts, it relaxes. That is the heartbeat. At that contraction point, the pressure you record is the systolic blood pressure. It shouldn't be more than once, but consistently. In those people with isolated systolic blood pressure, you find it be once. But the lower one, that is the diastolic pressure, that you record when the heart relaxes, contract, relax. So that one will be normal. But then the systolic one persistently will be high. That is what they call isolated systolic hypertension. You find it in the other people. And it's commonly due to aging process. You know, the blood vessels are getting less elastic and you have a deposition of materials inside the blood vessel. So, but of course, that conditions too, you must watch out and make sure you bring the blood pressure, systolic blood pressure down so that it doesn't lead to complications. So, these are the types. These are the types of hypertension. But remember, mainly primary and secondary. Let's take the stages. The stages of hypertension. First stage is when you have the blood pressure being between 140/90. Remember, I said anything above 140/90 we see as hypertension. But being lower than 160/100 is mild. It's mild, you know. It's something you can handle easily. But when the pressure gets above, goes beyond goes from 160/100 to like 180/110. That is a category you say is moderate. You know, it's intermediate, it's moderate, you know. So that one means it's getting higher. But again, you find that it could go beyond 180/110 to 180 over, in fact, the focus now mainly is on the diastolic, 180/120. 180/110 to 180/120. Once that lower one goes between 110 to 120, my brother, is now severe hypertension. That is a problem. These are the ones that before you know it can lead to stroke. So it's something you need to handle fast. But in some cases, we find cases where even that 120, the blood pressure goes beyond 120. That is 180/120. And it goes like 180/130 or something. That is the one they say is from severe. It's now malignant hypertension. It's a medical emergency. If you don't do something fast, the fellow might go. So these are the broad stages. But then there's this American Joint Committee on Hypertension. In 2014, they came up with a classification that people now think is a more modern one. You know, I think for those who are medically, their classification starts from normal, optimal, you know, goes down to, you know, hypertension, urgency and emergency and all that. It goes from that, it goes to optimal, normal, high normal, about 3 stages before you start having hypertension, urgency, hypertension, emergency. I think you can go, for those who are medically inclined, to get the details, you can go to our website, www.cophai.com. You know, in our blog section, you will have the details. Because also in 2017 now, there's another American College of Cardiology and the American Heart Association. They came up with another classification. And some countries have their own different classifications, like in Nigeria. You know, we have our own classification from normal, optimal, normal, high normal, then, you know, 3 stages. So you can get all those details for those for academic purposes. You go to our website, it's in our blog, you have the details. You know, it's thoroughly researched paper that you can go through and get all the information, all the other detailed information about the stages. So let's now talk about diagnosis of hypertension. How do you make a diagnosis of hypertension? Generally in the medical practice, you make diagnosis from history taking. You start by taking history. History is that you try to find out the person, you know, what is complaining about, how the thing started, you know, whether there are other associated problems. Think about family and social history. Whether there are people in the family who have hypertension and all that, so that you can know whether, it's probably a case of hypertension as a result of non-modifiable risk factor. So when you've done all that, you examine the fellow, check. You might find something. You can, even during your palpation, find out that the kidneys are enlarged and all that, and you concentrate your investigation on that. So, but aside from those basic things, there are common investigations you must always do for somebody who has hypertension, Of course, like I said, the thing starts when you examine, you check the blood pressure. And it's advised that you check this blood pressure at least 2 or 3 times within 1 week. And the WHO study group recommends that you do it in a sitting position. You check the blood pressure. If it is consistently elevated, then you start all the other investigations. But remember, there's a blood pressure you check. Somebody might not have checked the blood pressure before. The first one is giving you severe hypertension or malignant hypertension. You don't wait to do it a second time before you make up your mind that the person is hypertensive. You commence treatment immediately, because delay might be dangerous. So the common investigations you do urine test. You check the person's urine. You might even find other things, like if you have protein in the urine, you start wondering whether it has kidney issues. You might have sugar. You talk about diabetes, So you do it, and then there's this specific kidney function test, electrolyte, urea, and creatinine, that is recommended you do too. You check, find out the status of the kidney. You can do the lipids. Check whether the person has the lipid profile, whether it has elevated cholesterol and low density lipoprotein and all that. All these tests are so important for somebody that you think has a hypertension. It's so important for even follow-up cases and all that, and confirming, the prognosis of what you're handling. Generally, you should do X-ray to find out if complications are setting, if the heart is beginning to enlarge, because heart failure as a result of heart enlargement is one of the classical complications of diabetes. So you check that. Of course, there are some specific tests you do to assess the heart, such as ECG, electrocardiogram. You check about the electrical activities of the heart. There's a more advanced form of that kind of test they call echocardiogram. So these are all the tests you do. And of course, you can even do plain abdominal ultrasound. So it depends. These are all the things you put together to know, to be in the best position to manage a hypertensive case. So those are the things about making a diagnosis, of hypertension. And we usually end our talk by telling you that it's so important. The whole essence is to make you use this information. Share this information with people who it will be useful to anybody, especially the non-medical people. Don't let hypertension kill you. We've said that between the year 1990 to 2019, people aged between 30 to 79 years with hypertension, the number has doubled globally. And that 50% of these people don't know that they are hypertensive. So, you see, it's a problem. Don't let yourself be one of those people that don't know, that will suddenly drop them. So our message is that everybody, is a very simple thing to check. And that's why we commend all those health facilities that routinely, if you come on first visit, they check your vital signs, including your blood pressure. So many people that never knew they were hypertensive and people there. So please do these things. Stay alive. We love you. And of course, your very dear ones, they love you too. So that's why we encourage you to do these things. There are so many things you still can do for humanity. So don't die. Do not say it's not your portion. Who knows whose portion it is? It can be anybody's portion. Please, do this, get up, check your BP, so easy, and then follow the recommended steps that the doctor will tell you, or the nurse, or whoever checked it, in a case that your BP is high. Please don't joke with this. Thank you very much.